for the past, since 1990, our maternal deaths, the maternal death ratio has really just plateaued. It has not really gone down. And when you take a look at it, the challenge in the rural health clinics is that most of the maternal deaths here are really coming from the low-income sector. If you're a pregnant woman with means, you go for your prenatal, you go to your doctor, you go to a private hospital, chances are you'll survive. But not so much a poor mother. No?
And that's something that you guys are helping to eradicate?
Yes, so basically we tell them, this is a challenge that you have to face insofar as the mayor is concerned, which means that you have to identify the pregnant mothers, you have to see to it that they get prenatal, you see to it that they go to a facilities-based delivery rather than at home or with a traditional birth attendant, and if they're high risk, meaning to say they need a cesarean or they have potential complications, that they are referred to a good public hospital.
By your own assessment, the community health program as well as the maternal health program, how successful has Really Family Foundation been?
Given the approach, it takes them around 1 to 2 years to fix the system. By the third year, you would see the maternal mortalities really go down. So we say that we have been able to prove that if you fix the system, especially in terms of pregnancy tracking, in terms of giving them the prenatal care, in terms of getting them to the facility for delivery, you can really reduce the maternal deaths. No? However, over time, the deaths plateau. You still see deaths appearing. And when we take a look at it, two major factors I think that are coming up. Number one is that these are still deaths happening at home. Either they are poor, far away, and therefore they go to the traditional birth attendants, or they die in public hospitals. On the second point, it's a little bit more problematic because mayors have no control over the hospitals. And basically, when they go to the public hospitals, two major points that come. Either they arrive late, less than 24 hours, which means that there is something wrong with the referral system, or they arrive on time, but the hospital is not prepared. What does not prepared mean? They have no blood, no regular supply of blood, or no regular supply of obstetricians.
Just very quickly, Ernie, what is the next goalpost for you? What's the next milestone for the Really Family Foundation?
The next milestone of that is that we should be able to see improvements in those municipalities starting 2016 and 2017. No? So the experiences that we had in the 72 municipalities, the learnings there is now being transferred to 600 plus municipalities, and we say that by 2016 we should see improvements in that 2016, 2017, 2018. So maternal mortality should really be down by that period of time.